Hello and welcome to our latest board update video. This is designed to give members of staff in the organisation feedback from our board meeting in November to give you an overview of what we've talked about at the board. The board meeting this month started with my Chief Executive report where I was able to give board members an update on a number of key things we're working on as an organisation. First of all, our Symphony project, which is the project to look at how we can integrate care across hospital, community services, GP services and social services. And some really good work going on being led by Jeremy Martin to coordinate this piece of work on behalf of our organisation. Unfortunately, we had applied to become a pioneer nationally, which was a process being led by the Department of Health. We were unsuccessful in being selected as a pioneer bid, but that we remain undeterred as a health community, and we're still very committed to moving forward with the Symphony project. And there's lots of exciting work going on at the moment that a number of staff from this organisation are involved in, with a view to introducing new models of care from the spring of next year. We've also recently made a film that was taken at an event for staff and patients, looking at what the future model of integrated care could look like for the whole health community, and that's going to become available soon, and you'll be able to see both staff and patients' aspirations from what they'd like to see in any new system, so watch out for that film coming shortly. Secondly, I updated the board on progress around our Smart Care programme. Smart Care is the name we're now using for our electronic health record system, which you'll know that we have been successful in securing funding for in partnership with Gloucester Hospitals and North Devon Hospital. The process is now in a procurement to find a supplier, and we're down to 5 preferred suppliers who've been invited to submit full tenders, with a view that we'll be selecting a preferred supplier by the end of March. I've asked John Howes, our Medical Director, to become the Senior Responsible Officer overseeing the programme, because it's really important we get clinical involvement in this project from the start. This isn't an IT project, this is a whole hospital transformation project, and it's going to touch every single one of us across the hospital, so it's really important that particularly clinicians understand what the opportunity is to use the electronic health record system in a way to improve the way we can deliver care, but also making sure that it enables us to become more efficient in the way we deliver our services in the hospital. I also updated the board on a couple of people issues. First of all, to update that Neil Tomlin, our current Associate Director of Nursing and Midwifery, will be leaving the Trust at Christmas this year to go and take up a new post with NHS England in Yorkshire, overseeing midwifery services up there. Helen Ryan, our Director of Nursing, and I have been having a number of conversations how we replace Neil's Head of Midwifery post, and we're currently in conversations with both the midwifery team here and also our midwifery colleagues at Dorchester to think about the opportunity potentially for sharing a Head of Midwifery post across the two organisations, and we'll be updating further on that as those discussions progress. I also updated the board on progress in the stroke review. Many of you may have seen the publicity last week around Somerset CCG's stroke review that they've been undertaking for the past 18 months, and they've had an expert panel coming in to look at what the future configuration of stroke services in Somerset should look like. Currently, the proposal that's been put forward from the expert panel to the CCG recommends one centralised hyperacute centre in Taunton, which obviously would have big implications for our stroke services here in Yeovil. Last week at the CCG's board meeting, they agreed that they needed to do further work on this proposal. They understand that the implications of this change could be very significant for us here at Yeovil, and there's further work to be done to look at both the clinical benefits, the cost benefits, and also critically the patient experience benefits of any changes to stroke services. And we're working very closely now with the CCG with a view that any further decision will probably be made around about March or April next year. The patient story we listened to at the board was presented by Teresa Coombs, the Business Manager for Cancer Services, and Joe Howarth, our Associate Director of Patient Safety and Quality. And they gave us feedback about the valuable learning we've had as an organisation following a very rare incident that occurred in the Cancer Services team as part of a patient's chemotherapy treatment. And the critical thing for us as an organisation was to look at how we handled the investigation, which we recognised hadn't been done as well as it could have been, And this patient experience and an unfortunate incident has led to a significant number of improvements in the quality of how we manage services in the cancer team, but also critically how we go through our root cause analysis process and investigate patient safety incidents when they occur within the organisation. And the board were very reassured to hear about the feedback and the learning we've taken from this one incident, but also wanted to follow on feedback in a few months' time to hear about the concrete changes that have been made in the organisation as a result of this particular incident. We spent some time at the board also reviewing our current performance in some of our key national and local standards, and I'm really pleased to say that the Trust is doing really well against all of those measures. Particularly our performance in our RTT, the waiting time from the point at which somebody's referred in to us to the point at which they receive treatment. We've got some very good waiting times. Currently most patients are only waiting 15 weeks for their treatment against the national target, which is 18 weeks. So we're doing really well, which the board were really pleased to hear about. Our performance in the infection control metrics remains good. Our MRSA, we perform very well. Our last case of hospital-acquired MRSA is in March this year. But critically, we've only had 4 hospital-acquired MRSA cases in the last 3 years, which is a really, really good performance. In terms of our performance in C. diff, we've currently got a trajectory in the organisation to have no more than 12 directly attributable cases of C. diff within the organisation. Currently we're about at 7, but actually when the infection control team have done some work to look at that, actually only one of those cases was there a possibility that was an avoidable case where we could have done something different to avoid the case. So actually we're performing really, really well in this, and that's been recognised by the local CCG, who've acknowledged the hard work that both the infection control team but also clinical teams across the organisation are doing to really make sure that we don't have cases of C. diff unnecessarily. In terms of our 4-hour performance standards for A&E, we are doing again very well. We're performing against the national benchmark of 95% of people being seen within 4 hours, and that's at a time of which the winter pressures are beginning to, we're seeing increasing activity, so it's really great that we're still managing to achieve those standards despite the increasing activity linked to winter. And also our ambulance handovers, the time it takes to hand over a patient from the ambulance to the nursing staff in the department, is again, we have some of the lowest waiting times for that in the southwest, which again was a really significant achievement for us as an organisation. Also, our board report on performance contains some really good reports about patient experience measures. In the last year, or this year to date from April, we've had more than 750 compliments where patients have actually written in to feedback really positive experience about their care here, which is obviously very rewarding to read. And if you look at our friends and family test results, we again have performed very well in September, which were the latest set of results that were received. In September, 95% of people said that they would be extremely likely or likely to recommend Yeovil Hospital to their friends or family. And this is the 6th month that we've been at or above 95%. So I think that shows just how well we're doing providing good quality care to our patients, to the extent that they would also recommend the hospital to their friends or family, which is a really great testament to all the hard work that everybody's doing across the organisation. Tim Newman, our Chief Finance Officer, also presented our key financial performance. The key messages from that are that overall we are doing okay. We are on line to meet our financial ambitions by the end of the year. We still got a significant amount of work to do, particularly in terms of our cost improvement plans, to make sure that we bring those in on track. But overall our financial performance remains positive. We are also beginning now, and Tim explained this at the board, the process of looking at our budget setting for next year. It sounds early, I know, to be starting thinking about this, but we're already starting negotiations with our commissioners, the clinical commissioning group, about the money they're prepared to pay us next year for services we provide, and that's starting to give us an idea of the level of improvement plans and efficiencies that we're going to have to deliver next year. So budget setting is well underway, and a number of the teams across the organisation are working with finance to look at the budget setting process and what money they're going to need to deliver the services for next year. So I'd encourage again any of you who have team management responsibilities to get involved in that process and make sure you are clear about what the budget setting process is going to be for the coming 12 months. The board were also really excited to receive a presentation from a number of people who've been engaged in a process called developing the master plan for our organisation, and this is particularly looking at the site and how we best utilise the site. I'm sure many of you know that we've been looking, and you've heard me talk about the need to look at our car parking provision in the organisation, and we recognise the priority that there is to get the car parking situation sorted. But we also wanted to make sure that we look at the opportunity that the health campus presents, the land we've got with the Cheverton buildings across the road from the main site. And what that told us as an organisation was we didn't really have a clear understanding of what the whole built site needed to look like in the next 20 to 30 years in order to enable us to do some effective planning of how we develop these various component parts of the site. So what we had at the board this month was a presentation about what the potential opportunities could look like for the site in the next 20 to 30 years, and also concretely what steps we could be taking now to move us down that journey of getting to that end point. So that was it was the first time we'd seen that as a board, which was really exciting to look at what the potential, the scale of the opportunity could be. But what we'll now be doing is sharing that with the wider organisation and also other stakeholders, particularly local residents, to understand what the site needs to look like in the next 20 to 30 years. So I'd encourage you to get involved and look at some of the drawings and the plans that are going to be coming out over the next few months, and give your thoughts about how the site needs to be developed and some of the concrete things we need to do in the next 1 to 5 years to make some real improvements in the site, particularly the parking situation, which we know is a priority for us. Just as a final point as well, at the board meeting we also learned that Mark Power, our Director of Workforce and HR, who we share with Dorset County Hospital, will be leaving us in February to go and take up the Director of HR post at the Oxford Radcliffe Hospital. This is a massive opportunity and a promotion for Mark into a very large and complex organisation, and we've obviously, whilst we're sad to see him leave us, we also recognise the fantastic chance this is for Mark to further his own career. What we've agreed with Dorset County Hospital is that we will go out and look for a shared HR Director post, and we'll be beginning the recruitment process for that in the coming weeks. The board were very sad to hear of Mark's news, obviously, but also excited about the opportunity to think about bringing in a new director into the board team from March probably it will be now. So overall, that was the key points of the board meeting. It was a really exciting opportunity to look at some of the future things that will be happening around the organisation. But as always, if you've got any points of clarification you'd like, or you've got any questions or queries on what you've heard from this video, please get in contact with me or the comms team, and we'll be happy to give you further information. Thanks very much.